Is Thunder Bay getting all the help it needs with COVID-19? We ask Mayor Bill Mauro. It's James with Net News Ledger. Joining us by Zoom is Mayor Bill Mauro. Mayor, welcome back.
Thanks for having me back, James. I appreciate it.
We have a situation in Thunder Bay. We're watching these COVID-19 numbers continue to climb. What do our readers and viewers need to know?
Well, you're right. They do. It's unfortunately a situation we've been in for 3 or 4 weeks now. We're on a daily basis. We are seeing the numbers rise steadily. I think there was some 40 odd cases announced today. I don't know how many were resolved, but still I believe there was a net increase again today. So there is a very long-term trend that's been established in the city of Thunder Bay. It continues. I don't know how much longer it will continue, but we're obviously in a very difficult circumstance. The trend obviously speaks to community spread. It's, as Dr. DeMille is saying, it's everywhere, or assume it is everywhere. And so, yeah, we need to obviously all do what we can to contain it. It's very frustrating because I do believe that the vast majority of people in Thunder Bay from almost the very beginning of the pandemic have been doing exactly the right thing. We appreciate that, there are occasions where not everybody has bought in, but I think generally, by and large, everybody's doing exactly and has been doing exactly what they need to do. And unfortunately, this trend continues. So we need to buckle down and just try and bridge through the next several weeks.
I think the health unit did something new today. They announced that 15 of the cases that they presented out today are from family contact, which is probably a bit of a wake-up call for a lot of people.
Yeah, I think sometimes that the more information that can be communicated out to the public might help. And the fact that it's been characterized the way you've just described it might reinforce for the community the seriousness of the situation. But as I said, I think most people already appreciate and understand that.
Now, is Ontario and Canada stepping up to get our city and our district what we need?
Well, we think we're gonna get some good information soon, James. We're hopeful. We heard a nice announcement yesterday. There was $2.4 million announced yesterday. That money is going to the District Social Services Administration Board. Of course, this is the organization in the city that is in charge of the sheltering component within the city of Thunder Bay, as well as a lot of other work that they do. But we've seen $2.4 million flow to the DSAB, so that's key. They will determine over the next period of time how they will be allowed to use that money. They need to submit a plan into the province for its approval first. Good news also that the money does not have to be used up by the end of this fiscal year, but it's available to be used April 1st and beyond into fiscal 21-22. So really good news there. We also have applications into the federal government, and we're hoping in the not too distant future that we will be able to make a positive announcement in that regard. That money as well would be there to support that isolation situation that's being maintained for individuals that need that kind of support. So there's been some good news there. We needed that. We've got part of it, and I think we're getting close to hopefully seeing an announcement on some of the other parts as well.
That's a good step. We are seeing some positive steps here. Across the entire, all of Western and Northern Ontario. So there's good news on the horizon. Yeah. It just means who wants to be the last one to get COVID before there's, we want to not have that happen here.
Well, I think the other thing we need, to your question, that was sort of the first piece I think that we need. There's that isolation need, which is very taxing when it comes to the health and human resources, as well as the financing piece of it. So we think we're in pretty good shape there now. But ultimately, of course, is the vaccine and how much of that we're going to get. I know I've received some concerns from the community yesterday when the AstraZeneca pilot in Southern Ontario was announced, and Thunder Bay was not included in that. There was a second piece announced where on Saturday, a larger region will begin to be able to administer the vaccines through their primary care providers. We were not part of that as well. So we've received some concern from the community in my office that how could Thunder Bay not be included in that, given we're in the gray zone and given we have one of the highest numbers of per capita infections in the province. And so We do have a meeting tomorrow with Minister Elliott's office. We've reached out to them this morning after learning about this stuff yesterday. We've reached out to them. We'll try and get some answers to those questions. Ultimately, while we're in the gray zone, the province's own policies dictate that you should receive larger proportion of the vaccines as they become available. So that's the second part to your answer. That's what we need. We need more vaccine. We are getting vaccines. People are being vaccinated down at the CLE. That's good news. As more doses become available, we believe that Thunder Bay, as prescribed in the province's policies, should continue to see a larger proportion of that vaccine.
Well, we have seen two things that have concerned me. One of them is Sudbury has just been put back into gray and lockdown. Yeah. And the other is some of the Southern Ontario media seems to be reporting our COVID numbers far higher than the Thunder Bay District Health Unit is reporting. I've reached out to the health unit. We've got answers that make sense to me, but sometimes I think some of the media outside the city kind of looks at Thunder Bay and goes, well, you know, murder capital, hate crime capital, all the bad things they can. It's an easy tag on our city. And I think, like you said, the vast majority of the people in our city are absolutely amazing. We do have some bad apples, but so does everywhere.
Mm-hmm. Well, I've done some media yesterday and today, both province-wide, pan-provincial, and national media. And I've done my best to articulate the situation here in Thunder Bay. I can't speak to the numbers that others are using. You've approached the health unit about that to get clarity. That's the appropriate thing to do. But we're certainly doing our best to tell our story, and we're certainly doing our best to advocate for the city of Thunder Bay.
And with that, Mayor Mauro, thank you very much for taking the time again this afternoon.
Thanks, James. I appreciate the time.
Take care.
Okay, bye-bye.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.